Hello everyone. In this session, we will talk about anatomy of the pharynx and esophagus. By the end of this session, you will be able to describe external feature of the pharynx parts, muscle action, innervation and blood supply. And also you will be able to describe esophagus external feature, muscle action, innervation and blood supply. And at the end, we will be able to discuss some clinical correlations. Pharynx. Pharynx is a musculofacial tube which extends from the base of the skull to the esophagus, and it is incomplete anteriorly. The pharynx acts as a common entrance to the respiratory and alimentary tract. The pharynx consists of three main portions or parts. We have nasopharynx, oropharynx, and laryngopharynx. The oropharynx lies behind the nasal fossa and above the soft palate, and it is contained pharyngeal tonsil in this part and also auditory tube or Eustachian tube. Oropharynx lies behind to the pillars or the tonsils, and laryngopharynx lies behind to the larynx. In oropharynx, we have the palatine tonsil, which is the oropharynx is behind the palatine tonsils or pillars, and in laryngopharynx we have pyriform recess or fossa. As you can see here, this is nasopharynx. It's from the posterior border of the nasal septum to the tip of the uvula. And then we have oropharynx. It's from the tip of the uvula to the tip of the epiglottis. And we have laryngopharynx from the tip of the epiglottis to the bifurcation of the larynx, and esophagus at the level of the cricoid cartilage at the level of C6. In the pharynx also we have two muscle groups. We have circular muscle groups and we have longitudinal muscle groups. Here we can see is the vaccinator, not including the pharynx. We have superior constrictor, middle constrictor, and inferior constrictor. This is a circular muscle group. At the upper esophageal sphincter, this is the junction between the pharynx and the esophagus. We have here is an sphincter, is an anatomical sphincter. This is prevent air from entering to the alimentary tract. This is an anatomical sphincter. Other than the inferior sphincter that prevent gas from acid from regurgitation. So upper esophageal sphincter is a muscular sphincter. It's found in the inferior pharyngeal constrictor. It has two parts, thyropharyngeus part and cricopharyngeus part. Between the thyropharyngeus and cricopharyngeus, this muscle group we can find is the most important clinical correlation here, cytopharyngeal diverticulum. And beneath to the cricopharyngeus, we also can find pharyngeoesophageal diverticulum at this side. Here is the superior pharyngeal constrictor, one of the circular muscle group, middle pharyngeal constrictor and inferior pharyngeal constrictor. And also we have other contributing muscle that come from the base of the skull. We have levator villi palatini, and this is one of the longitudinal group, salpingopharyngeus, soft palate. We also have palatopharyngeus, and from the styloid, this is stylopharyngeus group. This is a three circular longitudinal muscle group and circular muscle group. Again, we have stylopharyngeus, palatopharyngeus, and salpingopharyngeus. Stylopharyngeus is come from the styloid process, and palatopharyngeus is come from the hard palate and aponeurosis of soft palate, and salpingopharyngeus is come from the auditory tube. Here we have superior pharyngeal constrictor, palatopharyngeus, middle pharyngeal constrictor, and inferior pharyngeal. This is the palatopharyngeus, come from the aponeurosis of soft palate and hard palate. Here also we have the other of the auditory muscle group, tensor villi palatini. We have the levator villi palatini, and here is the pharyngeotympanic tube or Eustachian tube, one of the content of the nasopharynx. Here is the salpingopharyngeus from the styloid process. Here the pharyngeal tonsils, we have palatine tonsils, and up there is the pharyngeal tonsil adenoid and palatine tonsils. Adenoid is the pharyngeal tonsils, is found in the nasopharynx, and palatine tonsil is in oropharynx. The nasal septum is a salpingopharyngeal fold, soft palate, and this is the lingual tonsils. This all group of muscles of tonsils is forming what's called Valdayer ring, and this is the pyriform fossa or recess, one of the content of the laryngopharynx. Before we talk to the blood supply of the pharynx is encircled by three fascia, two type of fascia. We have pharyngobasilar fascia and we have buccopharyngeal fascia. Pharyngobasilar fascia lies deep to the mucosa of the pharynx form the internal framework and provides support to the muscular layer of when it's deficient from anterior part. Buccopharyngeal fascia is cover the surface of the pharynx or pharyngeal muscle from outside. Blood supply of the pharynx, we have ascending pharyngeal artery, pharyngeal branch of muscular artery, tonsillar branches of facial artery, and dorsal lingual artery. And also may receive blood from the inferior thyroid and ascending cervical arteries. We have an innervation to the pharynx. We have motor and sensory innervation to the pharynx. The motor innervation, we have the superior, middle, inferior constrictors and other longitudinal muscles except stylopharyngeals. All these muscle group are supplied by vagus and pharyngeal branch of the vagus nerve via pharyngeal plexus, except stylopharyngeus, which is supplied by glossopharyngeal nerve. And sensory innervation to the mucosa, nasopharynx is supplied by glossopharyngeal nerve, oropharynx is supplied by glossopharyngeal nerve also, and laryngopharynx is supplied by vagus and glossopharyngeal nerve. This is about the pharynx. We also have some important clinical correlation related to the pharynx in this part. As we said, we have two facial covering to the pharynx. We have pharyngobasilar fascia and buccopharyngeal fascia. This fascia creates some space. That's what most important when there is an infection to the pharynx or into the one of the part of the pharynx. And this space, we have retropharyngeal space and danger space. Retropharyngeal space is located between the buccopharyngeal fascia and perivertebral fascia, and the importance of this space is extended from the base of the skull to the middle mediastinum at the level of T2 or T4, and this is a sort of transmission of infection from the pharynx up to the middle mediastinum. And also we have other spaces called danger space, and this lies posterior to the retropharyngeal space between the alar and vertebral fascia, and this space extending from the base of the skull up to the diaphragm. This is the two important about the fascia and space of the pharynx. We have retropharyngeal space extend up to the middle mediastinum, and infection can be spread up to the middle mediastinum from the pharynx through the retropharyngeal space, which form what you call retropharyngeal abscess. And also we have danger space found behind this space to the retropharyngeal space and can extend up to the level of diaphragm. That is all about the pharynx. We have esophagus, which start as continuation of the pharynx, the level of cricoid cartilage. The esophagus has two parts. We found some part in the superior mediastinum and then shifted to the posterior mediastinum. It is also a muscular tube that convey the food from the pharynx to the stomach. It is follow the curvature of the vertebral column and descend through the neck and mediastinum, as we said. It has internal circular and external longitudinal layer of muscles. Esophagus, about fibromuscular tube, as we said, 25 centimeter long, extend from the pharynx to the stomach at the level of the T11, and it enters the superior mediastinum between the trachea and vertebral column. It's passed through the esophageal hiatus of diaphragm at the level of T10. It has three constrictors: severe cervical constrictor, thoracic constrictor, and it have diaphragmatic constrictor. Cervical constrictor, upper esophageal sphincter, also, as we talk about, it begins at the pharyngoesophageal junction, approximately 15 centimeter from the insider teeth. And this is a muscular constrictor caused by cricopharyngeus muscle, as we said, I have two parts. The thoracic constrictor is also this esophagus crossed by bronchus and aorta. It's a compound constriction which is first crossed by arch of the aorta at the level of 22.5 centimeter in the insider teeth, and where it's crossed by left main bronchus at the level distance from 27.5 centimeter from the insider teeth. And also the diaphragmatic constrictor, where it's like about 40 centimeter from the insider teeth. We have abdominal part of the esophagus is a trump shape, only 1.25 centimeter long. This is the abdominal part of the esophagus. In the anterior surface is covered by peritoneum of the greater omentum. It is fit into the groove of the posterior or visceral surface of the liver. The posterior surface of the esophagus is covered by peritoneum also of lesser omentum or omental bursa. We have here some clinical importance. Diaphragmatic hernia. We have two types: sliding hernia and rolling hernia. As you can see on the left side, this is a sliding hernia, and the right side is a rolling hernia or paraesophageal hernia. Blood supply of the esophagus. Esophagus has blood supply from the branch of the thoracic aorta, and it's also some branch from the aortic branch called left gastric artery. This branch of celiac trunk, and also has some branches from the left inferior pharynx. Venous drain to the esophagus. Esophagus drain to the systemic and portal system. Is drain to the systemic circulation, esophageal vein, and portal circulation by left gastric vein. Innervation of the esophagus. The esophagus is innervated by esophageal plexus that come from the vagus by anterior and posterior gastric branches. This is the parasympathetic innervation, and sympathetic innervation is come from the thoracic splanchnic trunk by the greater splanchnic nerve, and also sympathetic nerves that follow the periatrial plexus around the left gastric and inferior pharynx arteries. That's all about the esophagus and pharynx anatomy. Thank you very much.